So this is a study of patients with non-ischaemic cardiomyopathy. It's a common cause of heart failure. It causes the heart to pump inefficiently and can in some cases lead to a risk of sudden death. The mainstay of therapy is around medication. They can be very effective and can improve the heart function quite substantially in a number of patients. This is more about patients whose hearts remain impaired even though they're on good medical treatment. The current guidelines suggest that most of those patients should have an implantable defibrillator. So they look out for dangerous arrhythmias, so when the heart goes very dangerously fast, which can cause cardiac arrest. And in that scenario, the device gives the heart a shock and restores it back to normal rhythm and essentially saves the patient's life. But there was a big study that was published a few years ago now which showed that overall there's no benefit in implanting defibrillators in this population, and that has led to a change in practice. So many consultants are no longer putting devices into those patients. I'm concerned that within the population that was looked at in this other study, that there are still patients that are at risk and need a defibrillator, despite on the whole the patient population doesn't seem to benefit. If they have an MRI scan and it shows that they have scar within the heart, that does imply a higher risk. What we don't know is whether that patient population does need a defibrillator. So we'll randomise patients to either have one or not, follow them up and see whether putting in a defibrillator makes them live longer.